Hi, my name is Nilima Pahari. I'm 14 years old and I'm from Bothell, Washington. I know that when young people's mental health issues go unaddressed, there are long-term negative effects. It can damage their school performance, like attendance and grades. My question is, what resources do you see as most important for us to add as a statewide initiative for supporting youth mental health?
Okay, I'm glad you asked the question. It's a good one. Um, First of all, I think one of the things, and I get an idea, I represent a rural area, and the ESD, Educational Service District, ESDs, I don't know what their acronym stands for. They have been, they've gotten some money and they've actually hired a counselor and then contract with schools to help those schools in rural areas. I think that after COVID, it is really tough on all the kids, and it's been a real struggle. The challenge for the state is we cannot produce providers fast enough. And so I think that we're playing catch up, unfortunately. A couple ideas that has come up is that can Medicaid, Apple Health, be billed for counseling work that happens in the school? That is something that we're looking at right now, and I think that that would be helpful to help pay for the counselors. I think we need to make every effort we can to try to get as much help out there as possible, and it'll be a challenge, but I think that's the direction we need to go.
Well, that's a great question. And as the father of two school-age children, I know that students across our state are grappling with mental health challenges, particularly coming out of the pandemic. I think we're going to be doing some innovative things like piloting a program, a wellness app in a number of schools that could expand. I'm excited about that. It is an app that would allow you to do mood tracking, to do safe checks, and do a number of other things. I think how we bring healthcare closer to the schools is important too. I'm a big supporter of school-based health centers. I've been particularly involved and engaged in telehealth. And we know students are walking around with those phones. And so if we're able to do telehealth, whether it be in our schools or behavioral health services or at home, I think that's a way we can bring direct care to people who need to be getting a little help and talking it out. So I'm excited about that. I think these are important questions and something we'll be grappling with in Washington State. And we really need young people at the table to help be part of the solution. You're living these concerns, and we're hearing loudly and clearly, and we need to move quicker to address your issues.
Hi, my name is Yesenia Carbajal Mendez. I am 14 years old and I live in Rochester, Washington. Since we know that youth mental health is a huge issue, and if the legislature continues to wait, those numbers of those suffering will continue to rise. So why is it taking so long to create a program for these youths? Thank you.
What a great question, and I totally embrace your frustration as chair of the healthcare committee. We need to be moving quicker. Sometimes the incrementalism involved in trying to solve complex policy problems is really frustrating. It's frustrating to those of us in lawmaking, it's frustrating to citizens, and it's mostly frustrating to those that impact like you all. So our commitment is to be making some significant investments in the budget. We need to be held accountable, though, when we're moving too slowly. This is an absolute crisis. And if we don't address it, we're going to be, unfortunately, seeing more and more youth slipping into mental health crisis. And so we need access to providers. We need new technology to help access behavioral health care. And we need to be focused on the things that we think can really move the needle. It's really hard right now. One of the big challenges we face is in workforce. And I think one of the difficulties is we can't just snap our fingers and have a bunch of new mental health counselors and behavioral health providers. So we're really trying to create that pipeline of folks. If any of you all are interested in going that profession, please do. We need your help, but also retain those professionals we have. We saw during the pandemic, many of them left the field because it was so stressful. So what are the things we're doing? Are they being paid fairly? Do they have benefits? Are they being supported as well? So that's really something that I think is very important.
Well, it kind of ties into our first question. It's about workforce and getting them out there, and we just don't have it. That's what I mean, though. We are chasing a problem that's getting worse in our society, and people just need a little extra help. And we're just struggling to keep up and struggling to get there. We will continue to do our best and keep offering alternatives. Now, some of the most interesting things I've been hearing has been coming from the schools as they have been innovating on this and trying to get help for their students. And I think we need to be listening more to them. And this is a time when all ideas need to be considered. And we need, it's kind of like the old saying, all hands on deck. We need to figure this out. I think that there will be more resources every time the legislature meets to deal with these things because time is of the essence.